Stay tuned to find out the shocking truth about waking up during surgery. Imagine this: you're lying on an operating table expecting to be blissfully unaware as skilled surgeons work. But then, something terrifying happens. You wake up. You can't move. You can't speak. You're trapped inside your own body, aware of every sensation, every sound, every incision. This, my friends, is the stuff of nightmares, but for some, it's a horrifying reality. Waking up during surgery, medically known as anesthesia awareness, is a rare but terrifying complication. The thought of being conscious during what should be a sleep-induced oblivion is enough to make anyone's heart race. But why does this happen? And more importantly, what can be done to prevent it? In this exploration, we'll delve into the world of anesthesia, dissect the phenomenon of anesthesia awareness, and equip you with the knowledge to approach surgery with confidence. We'll examine the science behind anesthesia, understand the factors that can lead to awareness, and hear first-hand accounts from patients who have experienced this medical mishap. We'll also discuss the latest safety protocols and learn how open communication between patients and medical teams can significantly reduce risks. Before we dive into the complexities of anesthesia awareness, let's first understand what anesthesia is and how it works. Anesthesia is a medical marvel, a carefully orchestrated chemical slumber that allows surgeons to perform complex procedures without inflicting pain and distress on their patients. Think of it as a temporary, controlled shutdown of certain bodily functions, particularly consciousness and the ability to feel pain. Anesthesiologists, the highly skilled doctors who administer and monitor anesthesia, use a combination of medications to induce this state of controlled unconsciousness. These medications work by interrupting the nerve signals that travel between the brain and the rest of the body. This interruption effectively blocks the transmission of pain signals, ensuring that the patient remains comfortable and unaware throughout the surgical procedure. Anesthesia is not a one-size-fits-all solution. Different types of anesthesia are used depending on the complexity of the surgery, the patient's overall health, and other factors. From general anesthesia, which renders the patient completely unconscious, to local anesthesia, which numbs a specific area of the body, anesthesiologists carefully select the most appropriate approach for each individual case. While anesthesia is generally safe and effective, there are instances where the sleep isn't as sound as it should be. Anesthesia awareness, a rare but serious complication, occurs when a patient becomes conscious during surgery. This can lead to severe psychological trauma, including PTSD, anxiety, and depression. Patients often describe feeling paralyzed and helpless. Signs can vary from subtle to overt, including vivid dreams or hearing conversations. Section 4. The odds. How often does this actually happen? The good news is that anesthesia awareness is extremely rare. Studies estimate that it occurs in approximately 0.1 to 0.2% of general anesthesia cases. That's less than 1 in 500 patients. To put it into perspective, you're more likely to be struck by lightning than to experience anesthesia awareness during surgery. While the statistics may be reassuring, it's important to remember that every surgery carries inherent risks, and anesthesia awareness, though uncommon, is a potential complication that should not be taken lightly. Several factors can increase the risk of anesthesia awareness, including certain types of surgery, such as heart surgery and emergency surgery, where maintaining a deep level of anesthesia can be challenging. Obesity, which can affect the distribution of anesthetic drugs in the body. Certain medical conditions such as heart and lung problems that can interfere with anesthesia delivery. Use of certain medications such as muscle relaxants that can mask the physical signs of awareness. And of course, human error, such as equipment malfunction or incorrect dosage of anesthetic drugs. Section 5. Voices from the operating room. Real patient experiences. Personal stories of anesthesia awareness bring the issue to life. Emily woke up during a cesarean section feeling every incision. John felt trapped during heart surgery, unable to communicate. These stories highlight the need for better anesthesia safety protocols. Section 6. Staying safe. What can you do to minimize the risks? While the thought of anesthesia awareness can be daunting, there are steps you can take to minimize your risks and approach surgery with greater confidence. Open and honest communication with your medical team is paramount. Don't be afraid to ask questions about your anesthesia plan, discuss any concerns you may have, and share any relevant medical history. including previous experiences with anesthesia. Your anesthesiologist is your advocate and will work with you to create a personalized anesthesia plan that addresses your specific needs and concerns. In addition to open communication, there are practical steps you can take to prepare for surgery and reduce your risk of complications. Follow your doctor's instructions carefully, including fasting guidelines and medication schedules. Quit smoking and limit alcohol consumption in the weeks leading up to surgery. Practice relaxation techniques, such as deep breathing exercises or meditation, to manage anxiety and promote calmness. If you have any history of anxiety or previous negative experiences with anesthesia, discuss these with your doctor. Section 7. Open communication. Your voice, your safety. In the realm of medicine, knowledge is power, and open communication is the bridge that connects patients and medical professionals in a shared journey towards optimal outcomes. When it comes to anesthesia and surgery, your voice matters. Don't be afraid to ask questions, express concerns, and engage in a thorough discussion about your anesthesia plan. Remember, your anesthesiologist is your advocate, a highly trained professional dedicated to ensuring your safety and well-being throughout the surgical process. By working together, by fostering a relationship built on trust, transparency, and shared decision-making, we can navigate the complexities of surgery with confidence, knowing that patient safety remains at the forefront of every medical intervention. The advancements in medical technology, coupled with a steadfast commitment to patient-centered care, continue to drive improvements in anesthesia safety, making anesthesia awareness an increasingly rare occurrence. By staying informed, advocating for our health, and engaging in open communication with our medical teams, we empower ourselves to approach surgery with greater peace of mind, knowing that we are active participants in our own well-being. If you found this video informative, please like, comment, and subscribe for more content.